Look at this picture of old adults. Actually, all of us know older adults. The good side is that older adults are supposed to live longer. But the bad side is that aging comes with more illnesses, such as diabetes, such as stroke, and such as dementia, where cancer is actually the leading killer in old age, where most new cancer cases are found in old age, where actually cancer treatments are very costly, where the main reason for its costly is because cancer medication, which rose dramatically in the last 20 years. Actually, luckily, we have in Israel the National Health Insurance Law, which is supposed to cover all the health expenditures, both for young people as well as for old people. So actually, we are not supposed to pay anything. But is it true? Does actually we not pay anything? My name is Professor Aviad Tur-Sinai from the School of Public Health at the University of Haifa. And one of the main questions that I'm dealing with is, do cancer patients actually really receive full public funding for medication at the end of life? What I found in my research is actually 42% of cancer patients actually pay out of pocket for cancer medications. And in addition, what I found that they pay an average of $5,800 for cancer medication at the last 6 months of their life. So one thing that we have to ask ourselves is, can everyone afford this huge amount of money? This question raises many questions, such as social equity, such as financial hardship. And in regard with this financial hardship issue, we found that the cancer patients, 52% of the cancer patients actually declared that they had heavy financial burden because of the out-of-pocket expenditures that they had to pay. So actually, we have to ask ourselves, how did we end up in this reality, in this bad reality? So this raised two questions. The first one is, did patients actually choose medication which are not covered by the government on purpose? And the second question is, did a physician engage patients in their treatment options? So what we found is that 38% of the physicians actually ignored patients' treatment preferences. And in addition, we found that 34% of the physicians actually rarely discussed with patient financial capacity. So actually, all that means that we have a huge problem. And this problem means that actually we have an elephant in the room, which is a huge, huge, huge problem. Actually, the elephant in the room, this undiscussed issue, is the unspoken financial challenge at the end of life. But we have to deal with it. We have to speak and we have to solve this problem. So in order to solve this problem, I want to go a step further. And the next further that I go ahead is to initiate the Global Institute for Economics of Aging and End-of-Life Care. And this institute will deal with many aspects. It will deal with justice. It will deal with financial protection framework. It will deal with social equity. It will deal with welfare solution. It will deal with health system sustainability. And together, by creating this institute, we'll be able to bridge the gap that I spoke with you about, so that our loved ones can age both with dignity as well as with care. So thank you very much.